Hi guys, I'm Trudi. Welcome back to my YouTube channel. Today I want to talk about some of the most annoying things working in rehab. Don't get me wrong, I love being a therapist, but there are some things that it kind of gets you a little bit annoying. So in this video, I'm just going to share my personal experience of some of the things that I think are a little bit annoying. Also guys, please remember to subscribe to my channel and click the bell so you'll get notified every time I post a new video. I post a new video every Sunday. Now let's get into the video. And these are not in any particular order. I'm just giving my take on the things that I feel are a little annoying about working in rehab. And I'm speaking about working in a skilled nursing facility. Let's get into the video. Now, the first thing I want to talk about is HMO notes. Now, HMO notes, it all depends on the patient. Not every patient is HMO. You know, some are straight Medicare, some are straight Medicaid, and some are managed Medicaid. So for managed Medicaid, those are usually the HMO notes. Now, what's annoying is every week you have to do a HMO note for a patient. Now, in all fairness, if they're asking for a HMO note, let's say once per week, okay, fair. But sometimes you're asking for a HMO note, let's say on Monday, then again on Thursday. Come on. How much progress can somebody make in like a span of like 2 days or 3 days? So that's one of my annoying things is like, okay, every week, fair. But twice a week for HMO notes, we need time, you know, to show progress. And the next annoying thing for me is all the patients, you know, for all the OT practitioners, and when I say OT practitioners, I'm referring to OTA and OTR. All the patients, well, I shouldn't say all the patients, but a lot of the patients call us PT. You'll go to the room and introduce yourself and say, my name is so-and-so, I have you for occupational therapy, or I'm the occupational therapist, or I'm the occupational therapy assistant. Then when you finish, you will hear them on the phone talking, oh, I just finished PT. Oh my gosh, it's like, that's so annoying because even when you introduce yourself as the OT practitioner, they're still calling you PT. And another thing is, some people still don't know what OTs do. And you know what? This is not even just for a skilled nursing facility. Yes, sometimes the nurses, like, they're still sometimes clueless. Sometimes, you know, the other staff, recreation, they're still kind of clueless. So, you know, you constantly have to be reminding them, you know, what OTs do. But for me, it's kind of annoying. Another annoying thing is anything that affects payment for service is gonna affect us. So if there's like a new bill talking about you're gonna cut from Medicaid or Medicare, it's gonna affect our job. So it's like you're always thinking like, oh my gosh, you know, what's gonna happen? Don't get me wrong, you know, it's a very good feel. But you kind of have to be aware that any changes, let's say if there's changes in the Affordable Care Act, it's going to affect service. And not even just OT, but, you know, in this video I'm talking about as an OT practitioner. So that's something that's kind of annoying to me. And another thing that can be a little annoying sometimes is, I hate to say it, but some family members. No, don't get me wrong. I love the fact that, you know, some family members are really involved in their loved one's care. But then there are times when, okay, let's say a patient, you know, got a stroke. The patient might be, let's say the patient is in their, I don't know, 50s or 60s. You know, the patient is pretty young. And that patient was independent prior to the stroke. So sometimes, let's say the patient is not recovering or improving at the rate that they thought the patient would be improving. And a lot of times they feel like, oh, they're not getting good therapy. Some people, they don't understand that therapy is not like this magic pill. You know, like if you're having a headache and you take some painkillers, you know, it just go away. They don't understand that also we have to, you know, we have to take into consideration how severe the stroke was. And a lot of times I have to explain to them that as an OT practitioner, it's not just about like, oh, is the arm going to move again? It's all about helping you to regain as much independence as possible in spite of whatever, you know, limitation you have. So you might only be able to use one of your hand, but as an OT practitioner, we can still help you to use, to compensate, do different little strategies, how to function with just one hand. So a lot of family members, they don't understand that. And another thing too with some family members is, you'll be, let's say it's a long-term patient, and like they'll get picked up on therapy, for a short period of time, and they're not really doing much, they're not really like making much improvement. The family member will call and be like, why are you cutting them? Because you have to inform the family members when you're gonna discontinue therapy. So they'll be like, why are you discontinue it? He's still not walking, he still can't move his hand. But they don't understand that we have to justify why we're keeping them on therapy. It's easy for them to think like, oh, therapy is unlimited. But then if the insurance decide to audit the facility, they're not gonna say like, oh, we forced them, or not even say we forced them, we told them to keep him on therapy. They're not gonna really care. So it's kind of annoying, when some family members don't really understand like the process. Like, we use our clinical judgment to say that, what, this patient is at a level where we don't think at the moment you're gonna really improve much. So, we have to discontinue. And then when we'll inform the family members, a lot of times they don't really accept that. And another thing that's kind of annoying is family members who are not forthcoming. And when I say not forthcoming is, sometimes, let's say, I don't know, let's say the son or the daughter will bring either their mom or their dad, their aunt, whoever, to the facility. Sometimes, they'll tell them that, okay, auntie or mom or dad is going to be long-term. Mind you, I'm not talking about patients who aren't, let's say they're not cognitively aware. Like, I'm talking about patients who are aware, but sometimes because of, circumstances, maybe they might need 24-hour care. So because of that, they have to be in the nursing home. So some family members will, make that decision. I shouldn't say that they don't tell their family members that they're not going to take them back home. So the patient is thinking that they're going home, whereas they already tell us that they're not taking the patient home. So we're doing therapy still, and they're telling us, oh, I should be doing this because I'm going home, whereas the family member already told us they're not going home. And then we can't tell them that, this is what your family member says. Because even when they do like a care plan meeting, sometimes they don't really want to, like disappoint their parent or their aunt, uncle, that they're not going to take them home. So it's kind of annoying, because just be upfront with your family member. Tell them that at this point in time, you can't take them home. And also sometimes they give them the impression as if they're trying to, make arrangement to take them home, when that's far from the truth. So that's something that's, kind of annoying with some family members that are not forthcoming. Okay, guys. So that's it for this video. Thank you so much for watching, and I hope this video was helpful. Also, guys, please remember to like, comment, and subscribe, and share this video with someone who you think it might help. Also, remember to click the notification button so you get notified every time I post a new video. Thanks so much for watching, and I'll see you in the next one.